Millions of Americans are about to be at the mercy of an AI algorithm that will help determine whether or not they deserve access to healthcare. And many of them will likely die as a result. On Monday, the administration officially rolled out a new final rule ordering states to implement strict work requirements for most Medicaid beneficiaries between the ages of 19 and 64. Because of this, all across the country, state Medicaid agencies are now being forced to funnel tens or even hundreds of millions of dollars into integrating the administration's new demands into their application and approval process. And it may sound relatively easy to add work requirements into the application system, but it very much is not. It means completely reworking your application process, completely reworking the old and decrepit technology that runs that application process, and hiring a metric ton of additional staff to actually process all of that additional paperwork and verification materials. It is a massive undertaking, even at the best of times. And as anyone who has visited a grocery store or put gas in their tank lately can confirm, we are not currently living in the best of times. And when Americans are struggling financially, that also adds significantly more burden onto those already extremely burdened agencies, as more people are forced to turn to social safety net programs like Medicaid just to stay alive. So it should come as no surprise then that some of those state agencies are now choosing instead to implement artificial intelligence into their application process, rather than spend tens or hundreds of millions of dollars that they likely do not currently have to spend in order to meet the administration's strict deadline for this. A survey of each state's Medicaid agency by KFF Health News found 6 states thus far that are planning to use AI in some part of the work requirement implementation. This is despite the fact that many states also told KFF that they had significant concerns that these AI products being provided by outside vendors may not be able to safely verify common non-traditional employment structures like gig work or self-employment, and may falsely deny applicants who are medically frail, homeless, or fall within some other nuanced hardship exemption category. In other words, they're worried that these AI-driven systems are going to wrongly deny people healthcare, and that those false denials are going to happen to the people most in need of that healthcare. And this is a deadline, by the way, that is being imposed by no one but the administration. They could easily push the deadline back and give states adequate time to actually implement this without causing widespread chaos that ultimately hurts patients most of all. Or even better, they could choose to just not push work requirements in the first place in the midst of one of the worst job markets we've seen in a very long time. This is pure cruelty for cruelty's sake, at a time when millions of Americans are barely keeping their heads above water as it is.